One of the things that we believe in terms of MSD for Mothers that we can do is to help elevate Nigeria's priorities on the global stage. We have access and platforms which gives us access to a number of different stakeholders in different places, and we try to basically do that. In terms of what I want to accomplish today, there are three things. The first is to tell you why maternal health should be a priority in this country, or should continue to be a priority in this country. And I know there are many people working in this area. The second is that the private sector has a significant role to play, both in terms of maternity care, but also in terms of strengthening the health system here in this country. And we've heard a bit from Olumide about some of the things that can be done there. And last but not least, in terms of my own personal journey, the fact that through engagements with corporate organizations such as MSD International, and I'm sure many of you can think of other corporate organizations, you can actually make a difference and you can contribute to the health sector within this country. So to the first thing, which is basically about the prioritization of maternal health in Nigeria. For us, MSD for Mothers, the simple answer is no woman should die giving life. That's the baseline. That's where we stand. But if anyone wants any other rationale thinking of, why contribution and why they make a difference, okay, we'll give you a few. If a mother stays alive, we know that basically her child is likely to survive up to the age of 5, significantly. We know that basically that child is likely to go to school and therefore have a chance to be able to contribute to wider society. We know that basically women contribute significantly to the GDP of our country. So there are all those very, other reasons why, mothers deserve to stay alive. However, the baseline is no woman deserves to die giving life. Nearly 60,000 women die every year in Nigeria from maternal mortality. That's 20% of all global maternal mortality. It's huge. And some people may think, okay, maybe that's because of our population size, and therefore, more likelihood maybe because of the high birth rate for women to die. But okay, maternal mortality is measured by something called MMR, maternal mortality ratio. And that's basically the number of deaths per 100,000. So let's make some comparison. In Nigeria, it's 819 per 100,000 live births. In Ghana, it's 329 per 100,000 live births. In Rwanda, it's 290 per 100,000 live births. I think those numbers are still pretty horrific, whichever country you look at. But let's think about maybe a country which I grew up in, the UK, or where I am based now in terms of Switzerland. Let's just have a show of hands, or some numbers in terms of what people think the maternal mortality ratio is in England, for example. Any guesses? Nobody Googling, please. What? Huh? 100? Someone said 100 over there. Okay. We've got quite a big spectrum from 4 to 100. Okay, the actual figure is 5. So you can see the contrast between 819 and 5. The bottom line is we know why women have an opportunity, the potential to die in childbirth. We know the interventions. We have the solutions. We have the knowledge. We've known this for years. So there is really no excuse why women are dying today at that alarming rate in Nigeria. And just to give some, to elaborate slightly, I came back a few days ago, and in conversations with friends in my network, 2 people told me about people they've lost. I mean, you just wouldn't have that conversation typically in the diaspora. I think that basically stressed to us why this is an emergency. It's something that we really need to engage. And that's why at MSD for Mothers, we've decided to invest in 2 critical ways to try and create a solution, or to try and contribute to the solution here in Nigeria. The first being improve access to quality care, and the second being increasing access to modern contraception. So let me give you some examples in terms of some of the things that we're doing. When we first started the program a number of years ago, and we made this commitment, one of the first things that people said to us, look, you need to try and solve for the biggest challenge we face in terms of maternal mortality, which is finding a way to prevent postpartum hemorrhage and having a heat-stable uterotonic to be able to help in this solution. So the gold standard is a drug called oxytocin, which needs refrigeration, needs cold chain. And you can imagine with the electricity supply that we have in the country, again, I don't want to get kicked out and not be allowed back into the country, but it's a fact. We have really poor infrastructure. And it's the same in a number of other low, middle-income countries. So we looked through and thought, okay, what can we do in terms of trying to solve for this particular challenge? We looked internally as a pharmaceutical company and thought, okay, what do we have maybe in the pipeline or within our, previous investigations that we can actually lean on? And we couldn't find anything. So we didn't stop there. We went out and I looked around and said, okay, what are the solutions that are potentially out there that we can actually bring to the mother's bedside? And we found a little pharmaceutical company called Ferring Pharmaceutical based out of Switzerland. And they have a drug called carbetocin. It's been used for and indicated in prevention of postpartum hemorrhage in C-section for over 20 years or so. But it didn't have an indication for prevention for postpartum hemorrhage in vaginal birth. And we thought, okay, interesting. But they've also done some recent research around making this drug stable, heat stable. So we thought this has a potential. And we teamed up with Ferring and also the World Health Organization, WHO, to study this drug and look at its potential to prevent postpartum hemorrhage after vaginal delivery. Fast forward, 2018, we had the publication of the comparison study between oxytocin and heat-stable carbetocin, published in the New England Journal a few months back, I think it was June, showing non-inferiority between the 2 drugs. That's one thing, because potentially mothers have an opportunity to have a solution at their bedside that can prevent postpartum hemorrhage. But I also think, and we think this within our team, that given that basically the trial work was done in 30,000 women across 10 countries, including 3,000 women here in Nigeria, in Ondo and Oyo State, what that is actually also doing is helping to strengthen the research capacity within the country. I've lost track of the number of times when we're trying to have a discussion about an intervention and we're like, okay, we need data on that. And they're like, oh, there's no data. And we're like, okay, well, why isn't there data? Well, nobody ever studied it. Okay, can we do data research on that? Well, we're not really sure whether we have a facility or a university that can actually do that work either. Those little steps, I think, makes a difference. It strengthens the health system in terms of being able to give the opportunity to very able Nigerians like you and I that can actually do the work and want to do the work to better their country. But we all need to be able to actually make sure that we are actually taking that step by investing in the ecosystem. The other example I wanted to give is somewhat abstract, or might be somewhat abstract to many, is actually how we actually help in terms of elevating some of Nigeria's health priorities on global platforms. So I'm sure people have heard of things like Every Woman, Every Child, Global Compact, and some of these initiatives, and you kind of think, okay, that's all very nice, lots of English, and it's very distant from us. But through one of these platforms called the WHO QED stands for Quality, Equity, Dignity. It's an initiative to help halve maternal mortality and halve stillbirths in facilities across 10 countries that are participating, and also improve the experience of mothers that are going to those facilities. Nigeria is one of those countries that's participating in the QED. And what we're doing is prioritizing, advocating, and this is part of my portfolio of work, advocating for private providers to be included in this QED work. And you may ask, why is that so wonderful? But the reality is, we know that 40% of women deliver in private facilities in low middle income countries. In somewhere like Nigeria, particularly somewhere like Lagos, the figure's even higher, it's up to 70%. So if you're trying to improve quality of care and you're just focused on the public sector, as important as that is, you can't change the overall ecosystem by ignoring a significant part of where the challenges may exist. We also know that basically the level of care that people receive in the private sector, as well as public sector, varies significantly. So we need to raise the whole ship, not just part of it. So that's another way in which we're trying to make a difference. So we've actually invested in 3 countries, or in a program that includes 3 countries, including Nigeria, to make sure that these private providers are included within the QED framework. One last area that I just want to briefly touch on is, again, leaning on the private sector and the contribution potentially that private sector can actually make to our health ecosystem, is the use of PPMVs. I'm sure most of the people in the room knows about them, and access to modern contraception. Nigeria has 10% use of modern contraception by married women. That's one of the lowest globally. Again, I don't want to get kicked out, but fact. Now, how do we increase that? We've tried different, avenues in terms of trying to, get to increase the uptake of and use of modern contraception, but it just doesn't seem to be quite working. Now, one of the things that we're exploring with a number of partners is to think about the use of PPMVs and seeing how they can get modern contraception to the last mile. Very often, the women that need these products don't have a pharmacy sitting on their doorstep, but they need those very same access to medication, they need the same access to things like contraception that you and I do. So that's just another way in which we're trying to make a difference here. So I hope I've been able to tell you something about why maternal health needs to be prioritized in Nigeria. Also, the role that private sector like mine can make in this type of environment. Last but not least, my journey in terms of how I've been able to engage and contribute to the Nigerian health sector. And interestingly, this is something that I started off doing, not just in terms of MSD for mothers, but actually with a former company as well, working in HIV, and I actually recognized someone who I'd met, I think, 15 years ago or so, doing the same thing. I have a business background. I've worked in pharma for over 10, 15 years, actually more than that. So that's the way I know and what I'm used to, but I want to contribute back to my country. And there are avenues such as this in which also others can make a difference. So thank you very much.